Hello guys, welcome back to the channel Radiology Technologist. We are preparing for Radiographers Central State Government. This channel is yours. So kindly subscribe and like these channels. These are questions is very useful for Central State Government. This question paper of the Osssc Odisha Sub Ordnance Staff Commission selections was taken in 5th May 2024. So we are going to further questions without wasting time. So we are going directly on medical laboratory, medical radiation technology. Okay. So first question is question number 16. What is which of the law? I equal to VIR. So here is given I equal to current, V equal to potential difference are constants. So his correct answer is Ohm's law. Everyone should know. Then ask about the blood group known as ABO. ABO is a antigen. So his correct answer antigen. Then we are going to question number 18. A full form of the ICRU. So his correct answer International Commission Radiation Unit and Measurement, just like ICRP, NCRP, International Commission Radiation Protection, NCRP National Commission Radiation Protections, and then ICRU, International Commission Radiation Unit and Measurement. Okay, these are the on the radiation protection. These are the measurement of unit, radiation unit measurement. Okay, this is the work ICRU. Then which substance used to harden fixing agent? They are given to potassium aluminum. So his correct answer is potassium aluminum. Metal penidone hydroquinone is a developer. Developer temperature is 20 to 20 degree 20 Celsius or 60 Fahrenheit. Keep in mind asking about the temperature dark room, then you can give the answer 20 or 68 Fahrenheit. Okay, then fixing agent or another potassium aluminum and sodium oxosulfide. These are the correct answer both. Okay, which of the following epithelial tissues work in X-ray, transport, protection, then secretion. These are the work for the epithelial tissues. Is a epithelial sweat gland at the secretion of the hormones. So T3 is like a thyroid gland, like another gland. They are secreted. Or excretions or protection. Protection is a skin or bone. So his correct answer given the epithelial tissue is a sweat gland. Option number 2. Then computed radiography employs phosphor, which works on the principles. So is photostimulable luminance, actually PIP, phosphor imaging plate. Then globally renew organization which impose healthcare related rules, regulation and legislations. So his correct answer is a WHO, World Health Organizations. Okay, is headquarters of Geneva. They have this 7th April maybe was established WHO. Okay, WHO World Health Organizations. Which instrument is used to detecting and measuring ionization radiation? Is the encounter. Geiger-Muller counters is full form. Geiger-Muller counters. Okay. Then first line imaging technique to stroke patient, acute stroke patient is correct answer CT. Then which of the following is nucleus, proton and neutron? HRCT, high resolution computed tomography. High resolution computed tomography. So his correct answer 4. What is the function fixing radiography film processing? His correct answer is to remove all unexposed undeveloped silver halide crystal from the emulsion. So his correct answer B. Which of the following are 3 basic principles of the radiation safety? Time distance shielding. 4. Environmental any disease transmitted from one infection individual to another person's by physically contact their secretion or airborne route is called. Airborne route is a transmitted through the by air through contamination of the, just like your patient a positive or infected person a positive, and then is the like going to the infection from the air, noise streak. So his correct answer is a contagious disease. Okay, environmental disease, environmental contamination is another. Catheter infection are different, and pathogen is a just like small microorganism, virus, bacteria. These are causes for the pathogens. Okay, PACS is picture and communication system is correct answer D. Nuclear binding energy or express is actually asking about the units. So everyone should know binding energy. Binding energy is a unit of MEV, mega electron volt. So his correct answer volt. Electron emission involved in injected in beta minus particle is correct answer. Electron emission of the involves in ejection of beta minus particle is correct answer C. Then what is the standard development manual film processing? So his correct answer 5 minutes. C. What reduce when patient is diagnosed with a dengue? Reduce. So his correct answer platelet counts. Platelet and WBC are decrease when the patient is diagnosed with dengue. Then infection acquired healthcare system is called healthcare association infections. What is the disadvantage of Railing Sole and computerized hospital information system? His correct answer is asking about disadvantage. Advantage minimum operational expansion, ready to assist patient, record better resolution management, but disadvantage hurting. So he's asking about the persons. Question number 37 is asking about the generation, later generation of the person receiving radiation is called as genetic effect. Then what is the name of the between left and right, left atrium and left ventricle is a mitras or bicus. Bicus is a right and left atrium and ventricles. So is correct answer fourth. Okay. What is the unit of exposure is a Roentgen, and Roentgen is a SI unit of coulomb per kg, SI unit, and these are the conventional unit Roentgen. Rem is a radiation equivalent dose, is a conventional unit. Rad is a radiation absorbed dose, is conventional unit, and is a SI unit of a Gray. Radiation equivalent is a SI unit of a Sievert. So this question asking about the exposure, so its correct answer is a Roentgen. Okay. Anyone have doubt about the units? You can comment here. I will express what is your doubt and what is the explanations about the units. So I will describe there. Which one of the following bone is embedded with a tendon? So is a hyoid bone. Name of the largest sesamoid bone in human skeleton is a largest. Asking about the largest, not longest. Largest sesamoid bone is a patella. Okay. Then asking of the creatine level. Normal creatine is 1.2. Sorry, just a moment. 0.6 to 1.2. But here is option 1, 0.7 to 1.3. Is correct answer is a fourth. There is asking about the what is the entry point of the kidney? Is a renal hilum. Renal hilum is a unit just like kidney. Then these are the hilum. These are going to the renal artery, renal vein, uterus. These are called the renal hilum. Okay. Scanner's view is used to petrous temporal bone. Then is asking about radioactive substance. So is 3D pictures. So his camera is actually spectroscopy. Then instead that tell the computer part to do solve. Is actually asking about the general knowledge. These are the software program. Application program is the use of app. What is the rule follow the human for examination lower abdomen during the X-rays? Is correct answer is the 10 days rules. Which of the following layers film silver halide crystal is a emulsions? It's a sunburst pattern on the X-ray. Is it osteoporosis, osteosarcoma, osteoarthritis, osteomyelitis? Is correct answer is a osteosarcoma. Osteosarcoma is a like a cancer, just like metastasis or benign. So is a osteosarcoma is sunburst pattern. Okay. And then asking about the MLD, maximum lethal dose. Is correct answer D. Reduce the intensity of X-ray beam is a regarding of the anode hill effect. Dash and dash have lower mass density and make anode lighter to easily rotate. So is correct on molybdenum and graphites. And then is defined as exposure resist curve with the useful density range. Is actually asking about the exposure cover with the useful density range. Density range is a contrast. Then SCW, hospital care workers. In X-ray emission tube, X-ray emitted by the acceleration of electrons. Which of the following fractures occur the skull infants? Is a spiral, pond, lateral, simple fracture. Spiral fracture, lateral fractures. So is a lateral fracture. Hyperthyroidism. This means is a high amount of the parathyroid hormone in the bloodstream. Is high amount of parathyroid hormones. T3, T4, just like pneumonia. Is a air sac may fill with the fluid or pus. Just like alveoli, there is filled with the pus and fluid. These are the pneumonia. HIS, hospital imaging system, hospital information system is correct answer 2. Then which of the following is not a property of X-ray? They are not deflecting electric and magnetic. Is right, correct answer. Correct property. Ions surrounding by discharging electric bodies required low voltage. X-ray electromagnets have short wavelength. Yes, required low voltage. Ions surrounding by air but discharging electrified bodies. Is required low voltage to produce X-rays? No. Is correct answer is C. Okay. Then appendix is located in the right iliac fossa. Actually 9 quadrant abdomen. 9 quadrant, these are the left side, right side is liver, hairs, is umbilicals, central is umbilicals, right is here is a lumbar, left lumbar regions, right lumbars, right lumbar, left lumbars, then hypochondrium, chondrium, iliac fossa, left iliac fossa, right iliac fossa. Okay, these are the 9 quadrants of the abdomen. So is the appendix situated in the right iliac fossa. So correct answer is a 1. Then material attenuation radiation potential reduce the exposure to the patient and staff in public is called as LED shielding. DICOM, digital imaging dynamic. Here is a mode of the medicines. Is correct answer is 4. What does ALARA radiation safety standard? ALARA full form asking of the achievable as low as reasonable achievable. So its correct answer C, as low as reasonable achievable. Then asking about the ACS, acute coronary syndrome is 2. During the storage of radiographic film processing developing solution, asking about the developing solution silver ion is the development. Which artery situated behind the knee is popliteal fossa and popliteal artery. So the correct answer is 4. What is the distance between safe light and film working bench is 1.2, not less than. Inverse square law. Intensity of radiation does to square of the distance. Is asking about the distance is a I equal to d1 equal to I to d2. These are the inversion square law. If the distance increase, exposure decrease by the 2 times. Okay. Then asking about the X-ray whole filaments is a thermonic emissions. Then create the detailed cross-sectional image of the body is a CT scan. SARC. Asking about the SARC, several airway respiratory, several acute respiratory syndrome, several types. So its correct answer is B. Then filter of the TLD, the thickness of have a thickness is a 0.8. Is asking about the CT house, our dimensional unit of inversely computed tomography. CT scan used to express CT number of standard and conveyed from Hounsfield unit, Doppler, acoustic, or its correct answer is a Hounsfield unit, HU. Then what is the SI unit of radioactive, which of the defined as 1 nuclear disintegration per second? So its correct answer, asking about the SI unit of radioactive is a becquerel and conventional is a QE. When asking about the conventional unit of radioactive, is actually correct answer is QE, and then ISI is a becquerel. 1 DPS, sorry, just a moment. 1 DPS equal to 3.7 into 10 raised to power 3. So its correct 1 DPS is equal to the 3.7 is a becquerel. Okay. Use of the lead in X-ray department. Embolization, radiation protection, chest X-ray stand covering. No, is the correct answer is a B, radiation protections. What is 3-domain industry safety? Occupational safety, fundamental, 3-domain industrial safety, electric, gas, oil and filtering. Occupational safety, electrical, industrial, function, non-electrical function. Occupational safety is correct answer is a B, not a C. FMR is a brain related. Tungsten used in cathode filament X-ray tube because it is a tungsten is a high melting point. What is the hematuria blood in urine? Which bone is most superior? Cervical, vertebral, patella, manubrium. Occipital bone is superior. Superior bone is actually skull, but skull is given not is given on the skull is the occipital bone. So it's correct occipital bone. Patella cervical is actually suppose you consider cervical vertebrae 2, but cervical vertebrae axis is a lower than the occipital bone. So it's correct answer asking what most superior is occipital bone. Parkinson's disease is a lack of muscle movement and neurological symptoms. So our patient was corporate and not a walk this clearly. So it's a lack of control of the coordination muscles movement. So it's a actually Parkinson's disease is a neurological syndrome. The curve given the relation between radiation exposure and optical density is actually characteristics curve. X and Y is exposure and it's a density. Is most important question last year 2023 DMR asked. X axis exposure and Y axis is the density is actually characteristic curve. Then mammographic film single emission type of use with what screen is double intensity or single intensity screen. Okay. Then more than intensity screen, what is the percent of reduce the radiation dose is 95% is more than 90%. Okay. Then electrolysis is a small intestine used to small intestines. Then temperature, asking about the temperature developing film processing is given to degree, so is a 20 to 22 degrees. So personal protective equipment is a PP kit. Ring enhancement lesion in brain most commonly associated with the multiple sclerosis is glioblastoma and cerebral aneurysm. Cerebral aneurysm is a going vessels are the aneurysms. Cerebral infections and multiple sclerosis are the is actually ring enhancement of the lesion in the actual lesion is the metastasis of benign, and multiple sclerosis are the given to multiple surface. Multiple in body are the lesion going to the like metastasis is a multiple sclerosis. Correct answer is a multiple sclerosis. Ring enhancement is a multiple sclerosis. Infections, then cancerous metastasis and benign. So its correct answer is multiple sclerosis. Okay. The set of protocol follow the reduce the contamination to avoid spread infection within healthcare setting are called infection prevention and controls (IPC). What is the primary disadvantage using gadolinium? Advice asking about the advantage is improve image visualization of blood vessels. In random fluctuation of the film density about the sum mean value following the circumstance, exposure is noise and motor. Then what is the mode of the heat transfer rotating in an X-ray nanotube is radiations. Hospital department where is X-ray is radiology department. OPG is taken to rule out the lesion. OPG is a mandible. Actually teeth. Orthoventricular is space. Subspecialty in radiology related to interventional procedure. Intervention is IR, interventional radiology. What is the target material used in mammography? Molybdenum. which of the following particle is given the smallest one? Is a these are the most important question is most of the candidates confusions when given the smallest particle. So you are going to the atom, but atom is not correct answer because the atom have a nucleus and nucleus have a proton and neutron. Proton and neutrons, when it's asking about the given the option is proton and there is no option given in the proton and electron and neutron, so you can go into the atom directly. But if given the answer is option atom, proton, electron, neutron, but you can go into the always you go to proton because it's atom and atom is a in atoms is a nucleus and nucleus is a proton and proton and neutron and they are the valence of electrons. So if given to the suppose option atom, proton, electron and molecules are the by number of atoms to make two molecules. Okay, but atom is yes, absolutely atom is smallest, but in behind the atoms is a nucleus is proton and neutron, so is going to this behind the smallest particle is a proton, so its correct answer is a proton. There is answer is a proton. If given the answer is not taken option is proton, so you can go into atoms. Okay, what is the golden rule of radiation? Is alara, distance approximately from the source of radiation. Air gap technique is mainly used to lateral view of the spine. Yeah, AP will not spine because it's a naturally create of the air gap technique in the lateral view of the spine. Okay guys, thank you so much for this watching. To make subscribes and to make you happy to your preparations, and best of luck for your going exams. Thank you.